Did you know prostate cancer is one of the most common cancers in men over 50? The scary part is, many men miss the early warning signs, not because they're not there, but because they're easy to ignore. In this video, we're breaking down 7 symptoms men over 50 should never overlook. If caught early, prostate cancer is often treatable. So, grab a seat, and let's talk about what every man and every family needs to know. Why men over 50 should be aware. As men age, the risk of prostate issues naturally increases. After 50, the chances of developing prostate cancer rise significantly, especially for those with a family history of the disease. While many prostate problems are benign, others can be serious and require immediate attention. That's why knowing the symptoms and acting on them is so important. Understanding the prostate. Let's quickly go over what the prostate is. It's a small gland about the size of a walnut, located just below the bladder and in front of the rectum. The prostate plays a key role in producing semen, which carries sperm. Though small, the prostate has a big impact on both the urinary and reproductive systems. When something goes wrong, it can show up in how often you urinate, your sexual function, and even your energy levels. What is prostate cancer? Prostate cancer begins when cells in the prostate start to grow uncontrollably. Some types grow slowly and may not cause serious issues for years. Others are more aggressive and can spread quickly if not detected in time. Thankfully, when caught early, prostate cancer is highly treatable. The challenge is that early symptoms often resemble common aging problems, making them easy to miss. Why prostate cancer often goes undetected. Prostate cancer is often referred to as a silent disease because many early symptoms are mild or vague. Men might think it's normal to wake up at night to pee more often, or they may blame fatigue on aging. But small changes in the body can be important warning signs. So let's take a closer look at the 7 symptoms that men over 50 should never ignore. Symptom 1. Frequent urination, especially at night. One of the earliest signs of prostate issues is the need to urinate more often, especially during the night. This is called Nocturia. When the prostate grows or becomes inflamed, it can press on the urethra, making it hard to fully empty the bladder. As a result, men may find themselves waking up several times a night just to go to the bathroom. While this may seem like a normal part of aging, if it happens regularly, it's worth talking to your doctor about. Symptom 2. Weak or interrupted urine flow. Have you noticed a weaker urine stream or a start and stop flow when you pee? That's another warning sign. An enlarged or cancerous prostate can press on the urethra, narrowing it and making it harder for urine to pass through. You may also find yourself straining or feeling like you didn't completely empty your bladder. If this continues over time, it could be a sign that your prostate is not functioning properly. Symptom 3. Blood in urine or semen. Seeing blood in your urine or semen is always a red flag. Even if it's just a small amount, it should never be ignored. This can indicate inflammation, infection, or even cancer in the prostate. While it doesn't always mean cancer, it's a serious symptom that requires immediate medical evaluation. If you notice this symptom even once, make sure to schedule an appointment with your doctor. Symptom 4. Pain or burning sensation. During urination or ejaculation. Another symptom to watch out for is a burning or painful feeling when urinating or ejaculating. This discomfort may feel like a sharp sting or a dull ache, and could signal an infection, prostate inflammation, or even cancer. Some men might assume it's a urinary tract infection, but if the pain persists or happens often, it's time to get checked. Symptom 5. Erectile dysfunction. While erectile dysfunction, ED, can be caused by many things, including stress, high blood pressure, or diabetes, it can also be a symptom of prostate cancer. The prostate is located near important nerves and blood vessels that control erections. If those are affected by a tumor, it may lead to ED. If you notice changes in sexual performance, especially when combined with other symptoms, speak with your doctor. Symptom 6. Pain in the lower back, hips, or pelvis. As prostate cancer spreads, it often moves to nearby bones such as the hips, pelvis, or lower back. This can lead to constant or recurring pain in these areas. The pain might feel dull and persistent, or sharp and worsening over time. If you're experiencing ongoing discomfort in your lower body that doesn't improve with rest, it's important to investigate the cause, especially if it comes along with urinary, or sexual symptoms. Symptom 7. Unexplained weight loss or fatigue. Sudden weight loss without trying and constant tiredness can be signs that something is wrong. As cancer grows, it can drain your body's energy and affect how it processes nutrients. If you feel weak all the time or are losing weight without changes in diet or exercise, don't dismiss it. These symptoms may not be specific to prostate cancer, but they are still important warning signs that shouldn't be ignored. When should you see a doctor? If you notice any of these symptoms, even if they seem small, don't wait. It's always better to be safe than sorry. Early diagnosis gives you the best chance for successful treatment. A quick checkup and a few simple tests can make a huge difference. Don't feel embarrassed or afraid to speak up. Your health is worth it. Screening options for prostate health. There are 2 main screening methods for prostate cancer. First is the PSA test, a simple blood test that measures the level of prostate-specific antigen in your blood. High PSA levels may indicate prostate problems. The second is a digital rectal exam, DRE, where a doctor feels for lumps or abnormalities in the prostate. These screenings are quick, and while they may feel uncomfortable, they can help detect cancer in its earliest stages. Can these symptoms be caused by something else? Yes, many of these symptoms can also be caused by other conditions like an enlarged prostate B, pH, infections, or inflammation. But here's the key. You won't know unless you get tested. Ignoring the symptoms only increases the risk. Even if it turns out to be something minor, early action brings peace of mind and keeps you in control of your health. Tips to support prostate health. There's no guaranteed way to prevent prostate cancer, but living a healthy lifestyle can help reduce your risk. Eat more vegetables, fruits, and foods rich in antioxidants. Limit red meat, fried foods, and sugary snacks. Stay physically active and maintain a healthy weight. Avoid smoking and limit alcohol. These small steps can go a long way in protecting not just your prostate, but your overall health. Prostate cancer can be dangerous, but it doesn't have to be deadly. The key is awareness and early detection. If you're over 50 or over 45 with a family history, don't ignore what your body is telling you. The earlier you act, the more treatment options you have, and the better your chances of recovery. If you found this video helpful, give it a like and share it with your friends or loved ones, especially those over 50. You could be helping someone catch a warning sign they've been ignoring. If you or someone you know has experienced prostate issues, share your thoughts in the comments below. Your story might encourage others to take action. Thanks for watching. Stay informed, stay healthy, and remember, when it comes to prostate cancer, knowledge truly is power. Don't wait. Listen to your body and talk to your doctor.